Hey everyone, if you're ever unsure about when to prescribe antibiotics and when to avoid them completely, make sure you watch this video till the end. I have put together a very simple, easy to remember table with commonly used antibiotics and their doses that you can actually use in your daily practice. Now, let's talk about antibiotics in dentistry because, according to ADA guidelines, antibiotics are among the most commonly overprescribed drugs in dental practice. And in many situations, they are prescribed even when they are not indicated. So, first, let's clearly understand where antibiotics should not be used because this is the most important part. Antibiotics are not indicated for dental pain alone. Conditions like reversible pulpitis or irreversible pulpitis can cause severe pain, but they are inflammatory conditions and not infections that require antibiotics. The correct treatment here is definitive dental treatment and not antibiotics. Antibiotics are also not recommended for localized periapical abscesses when adequate drainage can be achieved. If the abscess can be drained or the source of infection can be removed through RCT or extraction, antibiotics do not add any additional benefit. Chronic conditions such as chronic apical periodontitis, periapical granuloma, or asymptomatic periapical lesions, they do not require antibiotics. These are localized inflammatory lesions and should be managed with appropriate dental procedures. Routine dental procedures, including uncomplicated extractions, routine third molar removal, scaling, and restorative procedures in healthy patients, do not require antibiotic coverage. So, the key principle is very simple. Antibiotics should never be used as a substitute for definitive dental treatment. Now, let's move on to where antibiotics are indicated. Whenever there are signs of systemic involvement, antibiotics are indicated. These include fever, regional lymphadenopathy, trismus that suggests that the infection is no longer confined locally. They are also indicated in cases of spreading odontogenic infections such as cellulitis, diffuse facial swelling, or facial space infections where there is a risk of further spread. Another important indication is in immunocompromised patients where even a localized dental infection can become serious. This includes patients with uncontrolled diabetes, patients undergoing chemotherapy, patients on long term steroid therapy, or patients with other conditions that compromise immune function. Now, antibiotics may also be indicated in specific prophylactic situations, such as patients at risk for infective endocarditis, but only when they strictly meet the ADA criteria and not as a routine measure. So, again, the ADA logic is that antibiotics are indicated only when there is a systemic involvement, risk of spread, or increased patient vulnerability. Now, let's briefly talk about the commonly used antibiotics in dentistry. Amoxicillin is usually the first line antibiotic because of its effectiveness against common odontogenic bacteria and good oral absorption. In more severe infections, amoxicillin combined with clavulanic acid may be preferred. In patients who are allergic to penicillin, alternatives such as azithromycin or clindamycin may be used, keeping in mind their indications and possible adverse effects. Metronidazole is effective against anaerobic bacteria and is commonly used in combination with other antibiotics, but it should not be used alone for odontogenic infections. Now, let's come to the easy table I promised, which simplifies antibiotic prescribing in daily dental practice. So, the first line antibiotic used is amoxicillin. The dose is 500 mg every 8 hours for an adult. For severe infections, you can go with amoxiclav 625 mg every 8 hours. If the patient has penicillin allergy, go for azithromycin 500 mg once daily. Another for penicillin allergy, clindamycin 300 mg every 6 to 8 hours. anaerobic coverage with others, you can use metronidazole 400 milligram every 8 hours. Usually 3 to 5 days is the duration with reassessment. Antibiotics should be discontinued once symptoms resolve and the source of infection is controlled. So, to summarize, antibiotics are not indicated for pain alone or for localized dental infections that can be managed with local treatment. They are indicated only when there is systemic involvement, spreading infection, or increased patient risk. Responsible antibiotic prescribing not only improves patient care but also plays an important role in preventing antibiotic resistance. If you found this video helpful, make sure to follow the channel for more guideline based, clinically practical dental topics explained in a simple and easy to understand way.